Wash your hands and gather your supplies. Correct size NG tube, water-soluble lubricant, 2 10 ml slip-tip syringes, one with water and the second empty, Comfeel, Tegaderm, scissors, permanent marker, pH strips, blanket, pillow, and non-latex gloves. Any distraction items that will comfort your child, like a soother, music, or a special toy or video, and a second person to help you if possible. Wash your hands, open the NG tube, and close the caps to prevent any stomach contents from coming out once the NG tube is in the stomach. The NG tube is measured in centimeters. The measurements start at the bottom or the end with the hole in it, not at the end with caps. The even numbers 2, 4, 6 are on the tube. The dots in between represent 3, 5, 7 centimeters, etc. Have the child resting on her back with her head straight. Hold the bottom of the NG tube at the nose. Stretch the tube from the nose to the earlobe. Hold at the earlobe and stretch the tube towards the middle of the chest. Do not allow any slack in the tube. Find the end of the sternum, breastbone. Hold the tube at the sternum and stretch it to the navel, belly button, and find the middle point between these 2 points. Note the number and draw a line around the tube with the permanent marker. Open the water-soluble lubricant. Put the end of the tube into the package and put it down on a clean surface. The NG tube is ready to be inserted. Place your child on a safe surface. Place a large blanket under the child so you can bundle her arms and legs and elevate her on a pillow or rolled up blanket, supporting her head and shoulders. She should be elevated approximately 30 degrees. For older children, a parent can hold them on their knee sitting up or sitting up in a chair if they are cooperative and need little or no holding. Open the Comfeel and cut a strip. Hold one end touching the side of the nose, over the cheek and ending before the hairline. Cut to the correct length. Open the Tegaderm. Fold in half lengthwise and cut off approximately 1/4 inch. This will make 2 covering tapes. Fold the edges of the paper over so you will be able to apply the tape easier. Taping products and style may vary according to your child's needs. Have your distraction items in reach or music on. Have your helper hold the child's head and shoulders, keeping the head straight. Put the Comfeel onto the cheek by the nostril the NG tube will be inserted into. Hold the NG tube close to the end between your thumb and pointer finger. Put the tube into the nostril, pushing in slowly. Once you feel resistance, roll the tube upwards between your fingers and push forward slowly. The resistance you feel is the NG tube at the back of the nasal cavity. If the tube will not go in, pull the tube back gently and readjust the angle more towards the middle of the face. Try again, continuing to make small angle adjustments until the NG tube goes in. Once the tube has passed downward, you do not need to roll the tube anymore. Continue to steadily push the NG tube in till the mark is at the edge of the nostril. Your child may gag as the NG tube passes the back of the throat. If your child uses a soother, give it to her to decrease gagging and help the tube move down. Older children may sit up for the NG insertion and can drink sips of water from a straw while the NG tube is inserted to make the insertion easier. Tape down the NG tube. Comfort your child. Now it is time to make sure the NG tube is in the stomach. To confirm placement, aspirate or pull out stomach fluid. Open the NG cap and put the empty 10 ml syringe into the port. Gently pull back till you get fluid. The fluid should look like formula or fluid your child has drank, or it can be clear with white flecks. Push back in all fluid that is in the syringe. Remove the syringe and put the syringe with water into the NG port. Push the water into the tube. The water is to clean the inside of the NG tube to keep it from plugging. You are now ready to use the NG tube for feeding or medications. Only in hospital a pH test is required to confirm placement. At home, parents are to withdraw stomach contents to confirm the end of the NG tube is in the stomach every time before giving feeds or medications.